All right, guys, today we are going to be reacting to the healthcare in Germany. I have a lot of questions how the healthcare really works in Germany. Some of you guys are saying, no, you need to have your healthcare card. Some of you guys are saying it doesn't matter. You need to have your healthcare card. Some of you guys are saying you pay for the government. It's like having a private care, but it's the government, basically. Let's see what's going on here. Maybe they can answer some questions.
The last international healthcare system we covered, Singapore, got a great response from all of you. This week we head back to Europe. Specifically, we're going to Germany. Their universal healthcare system is based on the principles of Bismarck, which say that the state should provide only for those unable to provide for themselves. It's a private insurance system, and it's the topic of this week's Healthcare Triage.
Alrighty, so it's not a public system. It's not public. Okay. That's what he's saying. Get mad with him. If you guys have a problem with him with this video, just get mad with him, not with me.
It's mandatory in Germany. Everyone has to get it. Before 2009, some of the richest people in Germany could choose not to buy insurance, but that's no longer the case. Insurance is sold only by nonprofit private companies. There are more than 130 of them, and they're also known as sickness funds. There's statutory health insurance, or SHI, or voluntary private health insurance, or PHI. PHI covers some of the benefits that SHI doesn't, but most are minor. It also gets you access to some better amenities and covers some co-pays for other services. 86% of Germans are covered by SHI and 11% by PHI. As with other universal systems, the insurance is pretty comprehensive. Coverage includes preventive services, hospitalizations, outpatient visits, prescription drugs, mental health, dental care, eye care, rehab, hospice care, physical therapy, even sick leave is covered. Long-term care is covered by a different insurance, but that's mandatory too. There are limits to this though, and some people buy supplemental private long-term care insurance. Any employed citizens and pensioners who make less than 52,200 euros a year and their dependents are covered by SHI. Anyone who makes more than that or who is self-employed can choose to get the SHI or buy PHI. About 3/4 of people choose the SHI path. There used to be no co-pays for SHI, but some were added in 2004. They were about 10 euros for a doctor's visit. But in 2013, most of those were removed again. There are still co-pays, 5 to 10 euros for prescriptions, but lots of drugs are still free, 10 euros a day for hospitalizations, and 5 to 10 euros for medical aids. Deductibles can vary by plan.
I think that's fair. That keeps the system running. I think that's fair.
There's no cost sharing at all for kids, and a cap on out-of-pocket payments at 2% of household income. That number is 1% if you have a chronic illness. Out-of-pocket spending accounts for just over 13% of all healthcare spending in Germany, making it slightly less than Canada, comparable to the US, but much more than France. About 72% of healthcare spending is public spending, and just over 57% comes from SHI. Employees or pensioners pay an 8.2% tax on their wages up to 47,250 euros. Wages above that are exempt from the tax. Employers contribute an additional 7.3% tax. The contributions are all put together and then spread out amongst the nonprofit SHI funds. If a fund runs low on money, it can charge the members a bit extra. In 2011, 13 of the 156 funds did so, to the tune of about 100 to 180 euros a year. PHIs are considered private health spending. There were 42 of them in 2011. Slightly more than half of them are for-profit. The other slightly less than half are non-profit. The premiums are risk-based on entry into the program, meaning that older and sicker people pay more. Employers make contributions to PHI as they do for SHI, but the employee contribution is higher. PHI is still tightly regulated by the government to protect consumers though. Laws also encourage competition between the funds. Doctors belong to regional associations, which negotiate contracts with the various sickness funds. Outpatient docs work in private practice, for the most part, with 60% in solo practices, 25% in dual practices, and the rest in group practices. Mid-level practitioners, like physician assistants, are also employed in most offices. About half of physicians in SHI programs are family docs, and about half are specialists. Patients can choose any primary care physician, specialist, or hospital that they like. There's no real gatekeeping mandate, meaning that people can go to see specialists without first getting the permission of their primary care doctor. Although some funds do offer them, and offer incentives for using those gatekeeping functions. A relatively small number of people do, though. Most docs work in a fee-for-service way based on negotiated rates. There are preset maximum numbers of patients per practice, as well as reimbursement points per patient. This means that there are limits on the number of patients and number of treatments for which a doc can be paid each year. If a doctor goes over, they may not be paid.
Wow.
About half of all hospital beds are in nonprofit public hospitals. An additional third are in private nonprofit hands. The rest are for-profit, and that percentage has been growing. Most hospitals salary doctors who don't also work in the outpatient setting. The Federal Joint Committee decides what to cover and how to define quality. The Institute for Applied Quality Improvement and Research in Healthcare is responsible for quality assurance. Hospitals are mandated to report on 27 indicators so that they can be publicly compared. The country tries to control costs in a number of ways. There are a number of voluntary insurance schemes to do better disease management. Germany uses reference pricing with respect to drugs to try to get citizens to choose cheaper options. Basically, that means that the insurance will pay the amount of a cheapest drug in a class, and if patients want a more expensive one, they have to pay the difference themselves. A lot of research goes into deciding which drugs are most cost-effective.
So the system is built to make sure not only you get a free healthcare, but if you're gonna get some prescription, you have to choose the cheapest one. Am I right on this? Let me know in the comment section below.
Finally, regional budgets are used to hold down spending. For instance, if a doctor goes over what's expected for prescriptions for their patients, they are held financially liable.
Wow.
In 2011, Germany
very
spent
tight.
$4,495 per capita on healthcare, or about 11.3% of GDP. That puts it on par with France. It's expensive, except for the US, which is insane at $8,508 per capita and 17.7% of GDP. But unlike some other countries, Germans have
And also you have to include that we have one of the most unhealthy society ever built, because a lot of these people, I say that a lot of people that use the government healthcare that we have, the Medicare and Medicaid, are people, especially in Medicare, is people that are super unhealthy, man. I'm talking about unhealthy, neuropathy. I mean, these people, because I used to work in the financial industry as a life insurance agent. And man, these people, I'm telling you guys, these people are like, are a burden to the system, a huge burden. These people are going to the doctor like 5 times. They're 55 and they're going like 5 times to the hospital in 1 week. That's how bad they are. So that putting a lot of problem to the system. I think I'm the belief now with a lot of these videos that the United States government could have like a free of charge kind of system, but at the same time we have to just manage our health as well, and that way it's not a huge burden on the system.
great access. More than 3/4 of Germans are able to get same-day or next-day appointments with their doctor, putting them at or near the top of the developed world. Quality is generally good. Life expectancy at birth is 81 years, making them 24th in the world. That's behind Singapore at 84, Canada at 82.5, and France at 82.3, but ahead of the UK at 81 and the US at 79.8. In infant mortality, it beats most, if not all, of those countries. Germany has an above-average number of physicians and nurses. They have a below-average number of CT and MRI scanners. Their preventable mortality rates are well below OECD average. A 2012 study found that Germany outperforms the United States and sometimes the UK in preventing death. It loses to France, though. Downsides? Because doctors are spread out so much, there can be gaps in knowledge about what patients have and what's been done. Surprisingly for Germans, it's somewhat inefficient. The fee-for-service model encourages more care, which some think goes too far. And some doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot for care since they're responsible both for the employer and employee contribution. Finally, some claim that systems that employ tiers of coverage, specifically the SHI and the PHI, often lead to the wealthy doing much better than the not wealthy. But it's worth noting that the vast majority of people choose the SHI option. What keeps the public and the private option so close in terms of quality, costs, and benefits? Likely it's the German government, and there's a lot to be said for it.
Wow, wow, man. That great video, man. I mean, this guy really put a heck of a show, man. This is so good. It does answer some of the questions. It's something that has to be paid. Every citizen is demanded to pay for the system. However, as long as you have that card, you'll be okay, and the high quality is there. And also, it helps that the German society is very healthy. That really helps a lot, and that it helps a lot because then the burden to the system is not that big. The system is only used when it's necessary. Very good, very good. Wow, great video, man. What do you guys think? Do you guys like the video? Do you guys think there's a couple things here that are not making sense, or do you guys think that he hit the nail right in the coffin? Let me know what you guys think. I'll see you next one.